Hello, thank you so much for joining me today in this meeting. As most of you may know, my name is Richard Russell, and I am the new Executive Director of Healthy Community Brookfield. Today we will be talking about the current programs that Healthy Community Brookfield offers, as well as the services. We will also be talking about environmental factors that are affecting our organization. I wanted to go over a SWOT analysis with you guys, just looking at the strengths and weaknesses of our program. Currently, we have a vision and mission statement, but I wanted to show you just a couple ideas I had on a revised mission and vision. Then we're going to go over some strategic and action plans to help improve our organization, as well as the evaluation plan that we will use to test whether or not those action plans and strategic programs will work. So here are all the programs and services that we currently offer or in our present or in our past. HCB is involved with hospitals, including private physician practices, healthcare clinics, the VNA, rehabilitation clinics, skilled nursing facilities, nursing homes, Meals on Wheels, the YMCA, the list goes on and on. Most of you guys have been here for a long time, as long as 15 years, so you know in the beginning that we focus more on nursing and medical programs, including nutrition education for teens, babysitting courses, group bereavement classes, and caregiver support. I know that in the past, projects were chosen based off of the staff interests that were perceived. Our current programs and services that I see that we are working with now are women's health, primary care, and medical services, the prenatal and newborn care, mobile health and medical services, employee health and wellness services and area employers, the case management services for the elderly, violence prevention programs, smoking cessation, and more. So throughout the analysis of our organization, I wanted to discuss with you guys the environmental factors that are affecting the success rate of our organization. So number one is the community expectations and relationships. So how is Brookfield County looking at HCB? Like, what is our reputation? Right now, I feel like most of the community believe that we have good intentions, but they're a little confused as to what exactly we do and what we're involved in. Expect affordable. I know that most of the community expects affordable health and wellness programs and services through us. They rely on us for that. We're their resource. There are some economic factors, including the finances. That's why we did hire a financial officer to help increase our grants and our funding towards all of our programs and our services. And then that leads us to political environment. So how are our relationships with the Brookfield Health Department and the Brookfield County? I know right now we do have some issues with the PHAB accreditation. So here's the SWOT analysis. The SWOT analysis stands for strengths, weaknesses, opportunities, and threats. So here I outlined a few of each. In order for us to grow as an organization, we need to be able to admit our strengths as well as our weaknesses and kind of pinpoint where we can start to grow. So let's start on a good point, our strengths. As I pointed out before, Brookfield community believes that we do have great intentions. We are part of several organizations, as I pointed out in our earlier, all of our programs and services. We do have our financial officer to help bring in that money and the funding we need to keep our programs running. And all of you guys have been here at least 15 years. Not everyone, but I mean, we do have a really good handful of you guys that have been with us from the beginning and have seen where we started and how far we've come. Now let's talk about our weaknesses. We do have lack of funding and grants, which is why we hired the financial officer. Then, as I mentioned before, the PHAB's Domain 9 standards are not met yet. So that is a big thing because the Department of Public Health through Brookfield has threatened to end some of our programs because of that. So we definitely need to work on improving that. Lack of public knowledge of HCB, the HCB's impact and confusion of our services and duties. There's a lot of confusion on whether we're still part of the VNA or what exactly do we do. We also, unfortunately, overlap with our organizations and stakeholders. For example, we provide a diabetic program that's similar to the hospital. We kind of overlap with violence prevention. So I feel like we can save money from those programs by communicating with our stakeholders and determining, do we want to just let them take over the program, or do we want to combine what we're doing and work together instead of having two separate repetitive services. Some opportunities that will help us improve our services are better relationships with the Brookfield Public Health Department, improved community relationships, improved stakeholders relationships, improved funding and grant opportunities, because we can't get anything done if we don't have the funding, and myself, the new executive director, because I'm looking at our organization from the ground up. We're looking at all the little details that might have held us back in the past. Some threats are termination of organizations due to the PHAB domain standards not met, termination of HCAB programs due to lack of funding, broken relationships with those stakeholders due to repetition, and broken relationships with community due to lack of understanding of their needs. So, right now, our current mission states, as a nonprofit organization, Healthy Community Brookfield strives to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. I feel like it's just a little too long and we need something easier for our community to understand and focus on. So I revised it to improve Brookfield community's health. Very simple, to the point, but with a good intention. Our current vision states, as a nonprofit organization, Healthy Community Brookfield promotes healthy practices, which can lead to improved health behaviors, healthier individuals, and healthier communities. Again, very wordy, not very to the point. So the revised vision will be healthier behavior for Brookfield. Sorry about that. Healthier behavior for the community of Brookfield. So, I've been working hard to develop a 5-year strategic plan to turn things around. The first plan provides education to increase funding and grants. Plan number 2, create relationships with Brookfield Department of Public Health to meet PHAB accreditation requirements. 3, survey Brookfield community to increase knowledge and understanding of HCB. And lastly, 4, organize meetings with stakeholders to eliminate the overlap of programs within the community. So, how are we going to achieve goal number 1, which is to provide education to increase funding and grants? So, what action or change will occur? We plan on providing grant writing and budgeting classes for the financial officer. Though a financial officer is really, really helpful, I believe that we should just provide a little bit more tool and guidance for you to just continue to get the grants that we need. Obviously, the grant writing and budgeting professors and professionals will help with education. The plan is that the financial advisor will take classes twice a week for 6 months. HCB will request funding from stakeholders and the Brookfield Department of Public Health. Other funds needed will come from fundraising or from eliminated repetitive HCB programs, which I mentioned earlier. All partners, employees, and Brookfield community should know about this plan. We want to make our community know that we are working on strategies to increase our financial flow to provide. Action plan number 2, which is create relationships with Brookfield Department of Public Health to meet PHAB accreditation requirements. Meetings will take place between HCB and Brookfield Department of Public Health. You guys, the board of directors from HCB and Brookfield Department of Public Health, are involved with this plan. We will meet monthly for hour-long meetings. No money is needed for meetings, just time. However, meetings may result in a need for resources to meet PHAB requirements, which can be reached from increased grants, budgeting skills from action plan number 1. So each plan builds on each other. The only people that should know of this are stakeholders, us, HCB staff, and the Brookfield Department of Public Health staff. Action plan number 3, survey Brookfield community to increase knowledge and understanding of HCB. So the plan is to provide information sessions for Brookfield community. I will be involved. I will be presenting the information yearly for 1 hour. No money will be needed, and only myself will be involved with the presentation, and I will provide opportunities for questions and answers to directly involve the community in what we do, so they will be well aware and will be able to utilize the services and programs that we are providing for them. Lastly, the plan for the 4th goal is to hold meetings with the board of directors from stakeholders and HCB. So myself and the board of directors from both stakeholders and HCB will be involved. Bi-monthly hourly meetings will take place. No money will be needed for this. All we need to do is reinforce communications to stay on the same page, so that we eliminate all the repetition and just know what each other expect. So how are we going to evaluate all of these strategies? For the first plan, I plan on having yearly financial reports of grants received and money spent. Number 2, yearly report to show which PHAB requirements have been met each year. Number 3, yearly pre- and post-intervention surveys to monitor the HCB knowledge of Brookfield community. And lastly, yearly satisfaction survey of stakeholders about elimination of partnerships for repetitive programs and services. So we talked about what programs and services we have so far, what may be influencing the services so far. I went over the SWOT analysis with you guys, which determined our strengths and weaknesses. I showed you guys our revived mission and vision statements and talked about strategic and action plans to reinforce those new vision and mission statements. And we also talked about how we are going to evaluate the efficiency of these plans. So you guys will be involved all the steps of the way to get us to where we want to be and create the organization we want to help healthy community or Brookfield community live the healthiest lifestyles that they can. Any thoughts or questions? All right, thank you so much for your time, and we are working together as a whole to reach all of these goals. Thank you so much for your time.